I can't get him out of it. Does it matter if there are metal pins inside that P1? I block the MP like you said, but I push at the PIP joint and he reports pain. So it's a gradual push, right? So if you push into extension, then you want to pull into it as well. So you're gonna pull upward and then you're gonna push down, and it's gradual. And usually I will massage along the top, along the sides, and along the back. And I'll help to ease that pain. Fingers hurt. I don't care what you do, fingers hurt. The key thing is it's relative to their pain already, right? So if we're talking about working the yummy side and the yucky side, I always say if you go into flexion, that shit hurts like a mother, right? I'm gonna go into extension, it's gonna hurt, but does it hurt less? Yeah, right? You're the rock star, because you know I'm not pushing you into that hurts, but I'm gonna push you into extension. You can go nice and slow and easy and push it, and then when you do that, you massage the sides, you push it, you stretch it, you do some blocking, right? Do it a little bit more, and then have them ease into flexion and say, did that feel just slightly better? Was it less sharp? It's not that you're taking away their pain right away. PIPs are the most painful, and they hurt because they stiffen up so fast. So watch this video again. They stiffen up so fast. Use my same words. You have to pre-frame your patient's expectations. If you expect that you're gonna somehow fix this dude in like a minute and nothing will hurt, you're wrong. And you will like lay out that expectation for him too, and then he thinks something is wrong with you, and there's nothing wrong with you. There's nothing wrong with you. You're working it out. You're incremental changes for the better, right? Another thing I like to do that will ease someone's pain is if you push them into flexion, right? You push them into flexion, and then if you let go too fast, first of all, they're painful. They're gonna rebound out of that too fast, and it's gonna hurt them even more. So if you do a gentle, if you say, okay, so I want to straighten out your finger. So I spent the last 30 seconds pushing you down, right? Now I want you to straighten out that finger. We're gonna come out of that stretch and go into the other stretch. They're gonna gently push against you while you block them. It's gonna take the bite of the pain out so that they're not rebounding out of that stretch. Think about how fast, if your muscles, you go and you have real tight hamstrings and you're like, and then you come out of it too fast, it doesn't feel very nice, right? Any prolonged stretch that you do on your body that then you release too fast rebounds back, and it's not a pleasant sensation. So that's what your patients are going through. So if you want to take them out and you want to reduce their pain, have them push against you, right? And that'll ease their pain coming out of it. I didn't say you were going to be pain-free. I said you were going to ease that pain from being too sharp, right? And then when you go into work into extension, then you can also ease out of it as well, right? So then you can go push down and curl into my finger. You can go into block and then gently come all the way down. So anytime you're transitioning on a really stiff finger, then you transition smoothly and slowly.